Good afternoon and welcome to the DASH Mentor Program webinar. My name is Peter Eckert and I'm the Director for Health and Information Technology at the Illinois Public Health Institute, and I'm one of the co-directors for Data Across Sectors for Health. Here's the information about the meeting, which I'm guessing that you will have if you're on the meeting itself, so we'll dispense with that. Today's webinar is going to be a presentation from us and my colleague Claire Tanner, and then we will take questions and answers. You may also submit questions via the chat box in the upper right or upper right, I think, of your screen. We will answer questions out loud. We will also have a spot at the second half of the webinar where you can ask your questions spoken onto the webinar, and any answers will also be written down and posted at the Dash Connect website. So thanks for your interest in Data Across Sectors for Health and the Mentor Program. This is a brand new program for us at Data Across Sectors for Health, and it's really in keeping with what we're trying to do at DASH and as a part of our companion network, All In Data for Community Health. Both DASH and All In are really concerned with this work. We're trying to create and support and accelerate a movement where we recognize the importance of the social determinants of health and social forces as being the primary determiners of health, as opposed to health being created solely within hospitals and in clinical settings. The second thing that we're trying to do in DASH is to build an evidence base for the field. It's our experience and supposition that most problems and opportunities that you might face in your community have actually been faced or addressed, or at least tried to be addressed in other communities across the country. And so we are trying to understand what's happening, what's working, what's not working, document it, and then make that information available. And finally, the mechanism for that dissemination is really through peer learning and collaboration. At the heart of our work is a learning collaboration made up of communities that have been funded by DASH and our partners in All In, and in a growing way, other local collaborations that aren't necessarily funded but are trying to work on this stuff anyway. And so it's inside of that focus on the learning collaboration that we developed the Mentor Program. So let me talk a little bit about how DASH operates. I know that a lot of you know something about this, and really there's nothing special to this except for the way that how we do it. We work with grantees and partners. We disseminate these practices within the evidence base, and most importantly, we cultivate relationships with experts, both nationally and peer experts, to create this national movement to support the local initiatives. So I'd like to turn this over now to Claire Tanner from the Michigan Public Health Institute. DASH as a national program office is somewhat unique in that we are a partnership of two organizations, the Michigan Public Health Institute and the Illinois Public Health Institute. And so when we talk about sort of the joys and difficulties of collaboration, we know a little bit about that. But my work with Claire is mostly joy, and I'd like to turn over to her now to talk specifically about the DASH Mentor Program. Claire, take it away.
Thanks, Peter, and I'll just return the sentiment. So the purpose of the mentorship program, and I'm thinking that most of you, because this opportunity is for All In members, know enough about dash to know that we released other grants as well to communities for more inward focused work within their communities in terms of building collaborations, advancing their work around specific data sets or using data sets or specific maybe use cases or new partnerships within their multi-sector data sharing work. But the difference between our previous grant programs or financial award programs and this one is that this is specifically outward focused, and secondly, offered in recognition of some of the more high capacity communities. So the purpose statement here it reflects that sort of dual goal and that difference between our previous grant programs, in that we really want to recognize the high achievement of some of the multi-sector data sharing activities and communities within the All-In network, and try to replicate some of those efforts, translate, disseminate, make visible, lift up what's been successful about those networks in a number of different ways, so that other communities within All-In and across the country can benefit. Which is why we've listed some of the potential activities that might occur under that overall purpose in terms of creating and disseminating tools and resources, just doing more documentation, learning, and dissemination about what your community is learning. Certainly, one of the reasons that we're doing this is to make sure that the advanced communities within the All-In learning also have an opportunity to benefit from the network, and specifically to benefit because of their maturity, and then transferring again what they are learning to other communities that have in the network that have less experience. So next slide. So the way we're rolling this out is demonstrated here in this timeline. And so we've asked for an interest survey. We want to point out that that survey is an important first step, because the actual solicitation to apply for this funding opportunity is going to be invitation only, and we anticipate that that will go out on the 22nd with the subsequent due dates you see there. The maximum award of $50,000, it should be mentioned that half of that is meant to go to the actual mentor, and that the other half of that will go to potential mentees. In other words, other communities that would like to participate in a learning community around a specific topic. So that's just something to keep in mind. What we would be doing is working with you, as we, the NPO, would be working with the mentors that are selected as part of this process to identify who those mentees would be, and then invite them to participate. We do say a one-year project duration, but in recognition of what I've just said, that there's once the mentors are selected and brought on board, there's some design work to be done, both in terms of choosing the other mentee communities that are going to be part of the learning collaborative, but also in terms of designing exactly what the products and work plan is going to be, and we certainly anticipate that how that rolls out will be dependent in part on who the mentors are, which is why we haven't established it in advance. Please advance the slide. Great. So as I mentioned, this is we do envision that the mentors will be current members of All-In. And we have a way that we have defined what it means to be a member of All-In, and certainly current and former grantees of any of our official partners. So that would be us, but also the Community Health Peer Learning Program, the Colorado Health Foundation program, the BUILD, PHNCI, and if these acronyms don't mean anything to you, it probably means that you don't qualify under this specific bullet. So I think I'll just move ahead, but those are the official program office partners of All In other words, the ones who provide in-kind support to keep the learning network functional. In addition, we do have members of All In who haven't come in through one of these existing grant programs that have just sort of signed up and taken advantage and participated in various opportunities. And so what we would say is if you are not a member of All In, then please, you can do that. Anyone can become a member of All In. Simply, your first step would be to go to our online, the website, the All In website, and then link from there to the online learning collaborative and set up a profile, and then start participating in the things that we do, such as offer webinars and various other learning activities, participate on the platform, contribute to discussions, etc. There were a couple of other eligibility criteria on that last slide related to, having, being one of those high capacity communities in terms of having an existing multi-sector data sharing for community health initiative underway and being fairly advanced with it. And then, that last bullet's, I guess, a bit duplicative of what I said before. So, okay, please advance. Thank you. As I mentioned, we take the first couple of months to really design what the specific activities are, working with each mentor that gets selected, but these are some typical activities that are included within a learning program, and so we've listed them here. We are interested in if you filled out the interest survey already, you'll know that we ask for other ideas as well. So there could be some other potential activities that are proposed. Next slide. So DASH and our All In partners have identified a number of specific purposes or use cases that are really popular right now in terms of, the reasons why people are building multi-sector data sharing systems and processes. And we've identified some of the hottest issues and areas of focus that we see, and put them as the bullet points under this slide, but there might be others, which is why that last topic exists. And on the member interest survey, we're certainly interested in, the mentor interest survey, we're very interested in your feedback on maybe if there are other topical priorities or things that you think areas where more learning needs to be lifted up and shared with the world. So I won't go into that. All of this is described in the award announcement. Next slide. Sorry, jump back. Next. The next slide is just what to do next, which is to fill out that member interest survey. Yep. And then the next slide. So Q&A, and I think we're just going to open up the phone lines here. Want your questions about this opportunity and as well as feedback. And I see we've already gotten a little bit in the chat.
Thanks, Claire. Before we open up the phone lines, which sometimes can be loud and raucous depending if everybody has muted themselves, we do have a couple of questions that have come on since we started the webinar, and I'd like to answer those two first. Folks, you can use the chat to ask questions, and then in a few minutes we'll invite people to ask questions by voice. So the first question is, what is the application process for the mentees? Has that already begun? And the answer to that is in the announcement. I'm going to read this because I want to make sure that everybody has the same information. Dash mentors will participate in the selection of a small group of community collaborations that have a common opportunity or problem and would address that issue together under the direction of the mentor with support from the Dash National Program Office. So the answer is that we're going to select the mentors first, and then we're going to select the mentees. But part of the selection criteria for the mentors will be that we think that there is interest in the expertise and mentorship design that the mentors propose. And so the duration of the project, the whole mentor year is 12 months. And so the first month or two, as Claire said, would be related to program design, and then having the mentors participate in the selection of the mentees. As you can imagine, successful mentor applicants will be able to describe in the actual mentor application what what's the process or the elements for making decisions about who would become mentees. The next question that we have is, how many mentors do you intend to award? In the announcement, we say that Dash has allocated $250,000 for mentor activity in 2018. And so based on our anticipated design, that we'd be able to award up to 5 mentors. And so that would be 5 mentors, and then each of them would have a cohort. It's possible that a mentor might propose to use less than $50,000 for that whole cohort, but we expect that that's unlikely. Next question is, what is the approximate time commitment from the mentor per month? Is the mentor to mentee a one-to-one relationship or one mentor to multiple mentees? Let me answer the second part first because that's easier. We expect that it's one mentor to a cohort of mentees, probably no more than 5. The idea behind the funding piece of this is that the mentor would receive half of the $50,000 allocated for that mentorship relationship, and then the other $25,000 would be split between 5 mentees. Now we know that this may not work out exactly that way. We've never done a mentorship program like this before, but that's our default design. And we don't expect it would be a one-to-one ratio, but a successful mentor may make an argument that the cohort doesn't need it to be as big as 5 possible mentees. The first part of that question, I think, is the difficult one to answer, and I'm gonna try to answer first, and then invite Claire to also answer. The first part of that question is, what is the approximate time commitment from the mentor per month? So I think that this is a little bit complicated because the reason why the mentor gets half of the mentorship money is because we know that mentors want to continue to work on whatever data sharing opportunity that they're trying to advance. And so we anticipate that there will be some amount of this money/time devoted to the internal workings. Let's say it's a very specific technical issue. So we don't want to proscribe the amount of time that the mentor would spend. And so we want to encourage you to sort of think about that as mentors and think about sort of what does the $25,000 represent to you in time and effort and where you would apply it. We do anticipate that that you would have the support of staff within the National Program Office to help to run the cohort, but that you would be the primary subject matter expert and be intimately involved in running the cohort. This is all predicated on making the all-in network a greater value, and so a greater value specifically for the mentor and the mentees. But because all of this will be captured within all-in, we think that we would like to think that the learnings that will be developed here will be available beyond just the mentors. Claire, do you have maybe a more specific response to that question?
No, I think you hit on the two things that I was going to hit on, which is that certainly as part of the next step and the application process, we'd want folks to create a budget, and I'm noting that we need to be pretty specific in our guidance for that budget based on, again, the other thing you said, Peter, which is that we anticipate as the program office providing the basic administrative infrastructure and communications infrastructure and everything else, so that really what we want primarily from the mentors is the expertise and the time of the experts, and we can try to supply everything else. So that question raises a good point in terms of us developing the instructions for when you develop your budget. And certainly we don't expect to exploit folks. We want to make the budget work in terms of the time that we're asking for.
Thank you, Claire. We're getting a lot of really good questions, so this is great. The next question is, are mentors the agency or an individual from an agency that's an all-in participant? And so let me answer that not in a way that's not perfectly straightforward, but let me say that in the selection of the mentors, we're thinking about, who has been participating in all-in and kind of adding and getting value by being a part of the all-in network. And so, we tend to think of organizations that are part of collaborations, but obviously, there are individual people who show up and provide direction and consultation and provide the time that Claire just talked about. And so obviously we want to understand who are the individuals from the mentor organization that would participate, but it doesn't have to be a single person. It's people within an organization who are experienced and committed to this multi-sector work, and that's the expertise that we want to tap into. Okay, so here's going to be an interesting question. Let me ask Claire to answer this one. I can see at least 4 areas of expertise we could provide mentoring in. So in the application, my answers will change based on the area of expertise. Is answering the application in this way okay?
I have to say I'm not sure I understand the question.
All right, well, let me try to answer that one then. I'm going to say, I'll read it one more time. I can see at least 4 areas of expertise, and so that's the list of expertise we provide, right?
Sure.
And so based on the fact that there are different areas of expertise, in the interest form, we have multiple questions, and the person asking the question is asking, can my answers change based on which part of the expertise we'd be offering?
Right. So, I think do your best with the format of the survey to indicate that, to describe what you're thinking in terms of if we were selected for this topic, I'd approach it this way. If we were selected for this topic, I'd approach it this way. Sometimes we don't anticipate everything when we set up a form, but just I'd say do your best in the narrative to explain your thinking.
Yeah, I want to read this next question, or not, I mean, I want to read this next comment and then respond to it, because we try to be as straightforward as possible here at Data Cross Sectors for Health. This person says, I want to comment that I struggled with the application a bit because the mentor method and goals would change depending on the mentee selected and what their specific goals, problem to solve is about. I really appreciate that comment, and totally acknowledge that that is a true statement. I will say that because we have never run a mentor program like this, we are trying, we're creating something new. We're creating this new opportunity, and it's quite possible that the questions that we ask or the format don't perfectly align with the way that you are thinking about this. So all I can say is that completely agree with Claire and say that we won't let a poorly formatted question prevent us from understanding the value that you bring to this opportunity. And as I think we're really clear in the process, we said we want people to fill out the interest survey, and then based on the people that express an interest, then we will provide an invitation to a select group of people to give us a more full description of how they would run their mentorship, and in that part of the process, you will be able, I think, to be more free to describe exactly what you would do and how that would work. So thanks for the question and for the gentle criticism.
Yeah, and actually that is one of the reasons that we set this process up like this, with a survey and then this webinar. This webinar isn't a typical grant webinar where we're just pushing out information. We really did want this to be a dialogue, so that when the next step, which is the actual application, can be improved based on the feedback that we get both here today and in terms of the survey, as well as any questions that you want to submit on the link that was shared.
All right, and so I think that if you are hearing an invitation to give us any suggestions about how to improve this process while we still can, honestly, we're very welcome. We want this to be as relevant and meaningful for you, and as well as for other folks thinking about this. I'm going to read one more question, and then we're going to open up the phone lines. Typically, people on these calls are kind of shy, but I don't know if that will be you. And then while we're taking any phone calls, I'll also check the registration form, because a few of you did submit questions there, and I want to make sure we get to them. So we have a question. If you are a member of All In, but have not participated so far in the community, does this qualify you from being an awardee, even if you have an advanced working collaboration in place? So, again, let me try to answer this and then invite Claire. Right now, anybody can be a member of All In by expressing that desire and joining us in the All In online platform. So technically, that makes you a member of All In and therefore eligible for this opportunity. Obviously, if you have been participating in All In any function, in any way, for instance, if you've been attending our webinars, if you've been participating in any of the conversations in the online platform, if you presented at a conference, if you are a part of any kind of ongoing dialogue, any of those things indicate a higher level of participation and commitment to All In's network. So I would say that we will have a positive disposition towards people who have been participating in a stronger way. It's not really so much, it's really not intended to be an award, in that respect, but it does recognize folks who have already understood and contributed to the value of All In. I did say I sent a couple of notes out that for folks who haven't been strongly participating in All In yet, but sort of are interested in doing so, you're totally welcome to. And there's both. We'll do this mentor program again next year in 2019. But we also have smaller technical assistance grants for community collaborations that we through our program at Dash called Kickstart. So it's not in our nature to say no to people who express an interest, but I just want to be honest about the fact that we're intending to really lift up and continue to support folks who've been committed to the network in the couple of years that we've been operating. Claire, do you want to provide any more nuance than that?
No, other than if you're not sure, go ahead and fill out the interest survey. I'm hoping that that's kind of a low bar. And then, as I said, we'll invite folks. We're not going to invite people that we think are definitely not eligible. So it's probably just a matter of emphasis then in terms of the final awards. If there are two applicants that are, we otherwise similar, but one's an active member of All In, then they might get weighted heavier or something. So go ahead and fill out the interest survey, I'd suggest.
Yeah, I mean, All In isn't going away anytime soon. So, I know as someone who works in an organization where we submit proposals all the time, I really understand kind of the urgency when an opportunity is available. We also, at Dash especially, Dash as one of the partners of All In, we think about these opportunities like the mentor grant and like the Kickstart awards. We think of them as opportunities to start dialogue with people that we're not familiar with yet. For example, Claire and I had conversations with probably 15 of the people who we didn't fund in the last round of Kickstart, because we want folks to know, we can't fund everybody, but we hope that folks are interested in sharing their experiences through the All In network. I mean, that's really the purpose of the All In network, and the mentor grant is really intended to say we know that there's great value provided by collaborations and organizations that have a really mature understanding of community-based data sharing. All right, I can answer this question really quickly. Can I, as an individual, apply if my agency does not? No. I don't know if we put this into it's not in the eligibility, but only organizations. We should have done that. I'm sorry that this wasn't clear. Only nonprofit organizations and or governmental organizations are eligible to receive RWJF funding. And so even though this is a direct grant program of Data Across Sectors for Health, we are re-granting Robert Wood Johnson Foundation funds, and so individuals are not eligible for funding. Let's open up the phones and see if we've got any questions there. And I'll also take a look at the questions that came into the registration. The phone lines are now open. Is that right, Aroma? I can hear people typing. I can hear. So the phone lines are open. If you're not intending to ask a question, please mute your line. Otherwise, anybody who's got a question, please speak up.
I have a question. Where can we locate the interest survey?
The interest survey is available at a link that's inside of the document, the funding opportunity. Oh, and I will read that URL to you.
Okay. All
right. The interest survey is available If you go to the dash-connect.org site, you'll see a link across the top for mentor program. And if you click on that link, there's a description of what we're talking about today. And under how to apply, that's where the mentor funding interest survey link is.
I've also dropped the link into the chat box for everyone.
Oh,
Okay, thank you.
Thank you. More questions? Thank you to the person who did speak up there. I appreciate it.
So I have a quick question. My name is Sonia, and I'm with Alexandria Consulting. To what you stated about individuals not being able to be eligible for this particular funding round. So we're a private consulting firm that works with a bunch of communities and nonprofits. And so what we've been doing is collaborating with them. And then what we're doing is being technical advisors. So could we actually submit it under our partners organization and then basically work as a team to be the mentors?
That's a nuanced question. I'm going to give you a nuanced answer. It would really depend on the capacity of the partnership and the degree to which the community partner would have to be the applicant, the degree to which they've been participating in All In and leading the collaboration. Obviously, we talk about building local capacity to do multi-sector data sharing, and so the community would have to be kind of deeply involved in the process and leadership and execution of the work.
Okay.
Next question, if there is one. All right, while some of you might be waiting to ask, let me answer a couple of questions. Is Data Cross Sectors for Health, the mentor program, national in scope? And I'm not exactly sure what that means, so let me answer it a couple of ways. Data Cross Sectors for Health is a national program. We fund communities all across the country. We funded 10 grantees originally in 2016, and we've so far funded an additional 11 awardees under our Kickstart program, and these are all across the country. All In, our network collaboration, also operates across the country. Most of the partners are national organizations, although we also have state partners in New Jersey and California. And so the program is national in scope. The second way maybe of answering that question is, can a mentorship, proposed mentorship be national?
Is Diana up there with you?
Pardon me?
I'm in. Because I know you put a request in or had added something. I can see it. So there's both of our contracts are. I think they just need to go in. They have both of our contracts in the front page.
Sorry, I'm sorry. The person who's just speaking now, you are being heard on the Data Cross Sectors for Health Mentor Program webinar, which I don't think you intended to be. You might want to mute. So anyway, the second part of the answer to your question about whether this is national in scope is that it's certainly possible for a mentorship to be national, whereas an organization in one city might be a mentor to mentees all across the country that are united in terms of the problem that they're trying to solve or an opportunity they're trying to address. Let me answer another question. It says, do you have to build the system in-house, or can you qualify by leveraging query API interface HIEs like Care Quality? Again, that's a question that would probably benefit from some context, but I would say that for people who are proposing the mentorship based on technical system development, it's the job of your application to propose something that would be compelling for people outside of your own organization. The mentorship really asks the question, are you able to lead a small cohort of mentees who are interested in working on a problem with you? And so if that problem is technical in nature, it would have to be big enough so that there are other people around the country who are saying, yes, that's a technical problem that I'm trying to solve too. All right, I have one more question that came in the registration, and so after I ask this question, we'll go to the phones one more time. There's a lot of detail to this, but the questioner ends with these two questions. What will we be able or not able to use the funds for? And the second part is there a need to deliver a practical data solution, or would driving conversations, capacity, and pushing toward collaboration be considered a good outcome? So let me answer the first part first. What will we be able, not able to use the funds for? I think that this is, again, up to you to provide a compelling case for the use of funds. As I said, we are at DASH regranting RWJF funds, so there are a list of things you can and can't do. You know, you've seen, a lot of you have seen this list before. You can't do lobbying, you can't enrich people individually, those kind of things. We expect for the mentorship that probably most of the funding would be related to staffing costs, because we're trying to support subject matter experts to participate in this program. You may have other costs that would be reasonable for you, and we'd love to hear your idea for what that would be. We recognize that $50,000, especially spread over the mentor and the mentees, is a relatively small amount of money. So we don't want you to propose something that sounds really great as an application, but really you can't accomplish in a year. So we want you to be reasonable, because we don't expect miracles for $50,000. The second, and also I guess the other thing I wanted to say is that, to Claire's point earlier, you can sort of say generally your idea of the use of funds in the interest survey, and then if you're invited to apply in a more detailed way, you have an opportunity to get more specific based on questions that we might ask. And then the second question, is there a need to provide a practical data solution, or would driving conversations, capacity, and pushing toward collaboration be considered a good outcome? This is a great question, and it ties somewhat to what I just said about we can't expect miracles for $50,000. So we will ask, what are the expected outcomes of your mentorship for you, the mentor, and for the mentees who participate in that cohort? And I think we want you to think, think innovatively and aggressively, but not outlandishly, so that it may be that, conversations, we don't want to just fund a bunch of conversations, but if they result in increases in capacity that you can justify and measure, or that you create a collaboration that has some really specific outcomes, that is, I think, something that we're interested in. And again, we're trying to drive capacity development for the mentor and the mentees. So I think that we'll be very interested in understanding what all of the people are interested are thinking about, and in that second part of this really quick phase, really quick process, you will be able to provide more direction based on what you do. got some more questions. Let me, I said we're going to go back to the phone. So we've still got 15 minutes left. So if we have any questions from the phones, can we invite anybody right now to please speak up? Otherwise, we've got a couple more questions that came into the webinar. All right. Let me read another question. People are getting sick of hearing me. I'll ask the question. Claire, you provide the answer. Is the mentor helping the mentee solve or help progress their project or problem, or is the mentor equally involved in the project problem to solve? I'm getting confused between the two roles.
So I guess I'll punt a little bit to that planning process where we're going to get more specific. Again, the mentor, what we're doing is recognizing a community that's more advanced, and the mentees are participants. So if you wanted to design it such that there was an opportunity to co-identify the issues up front as part of that, you know, some of the initial work, that would make sense. You know, really what we're trying to do is spread the expertise that the mentors have and help make it accessible using a variety of strategies. And we will work with the mentors to help do that. Does that answer the question? And Peter, do you have anything to add?
I hope that does answer the question. I want to provide, I mean, we've been talking kind of really generally in this webinar, which is really intended to make people, to help potential applicants to think expansively about what they could do. But let me just give you an example that I think is relevant to this question. So probably the most, one of the most popular kinds of multi-sector data sharing that we're seeing right now is related to health and housing, right? There's a lot of folks who are recognizing the incredible power of housing as a platform, but also the way that housing data and healthcare data mesh pretty nicely to provide both a really nice, a much better understanding of sort of people's individual experiences, but also when you aggregate it up, to provide a good lens into sort of how a community is thriving. You know, the housing turns out to be, as we all know and are learning, to be really important. So it could be that a mentor has already had success of working on health and housing and wants to continue to work on that, either kind of generally or maybe on a specific kind of data sharing issue. I'm confident that there are other communities across the country who are also generally interested in working on health and housing, and they may be involved in a specific data sharing project, like, you know, trying to integrate healthcare data and housing management information services data, or maybe they're trying to work with a public housing authority that's, you know, that's partnering with a healthcare provider. So, you know, whatever the specific implementation idea is, it could be possible that the mentorship relationship is about the mentor saying, we've got all this knowledge and experience, and what we really want to do is help a group of communities move forward. And so they actually act like, you know, kind of a little consultancy that works, you know, with all of the mentees. Or a mentor could say, you know what, we want to work on this project, and we think that this project that we want to work on in our community, where we are experts and leaders, is something that will benefit other folks around the country who might be interested in working on this too, but aren't as far along. So it's you know, we want to be both and kinds of people here at Data Cross Sectors for Health. And so I think that we're open to both kinds of models. And really, I think that the the question that potential applicants is, how do we want to sort of, divide our time and effort here? Do we want to act as sort of, consultants and spend most of our time helping communities to move their things forward because we recognize our role as leaders? Or, are you saying, what, we'd love to work on something with a group of other folks who want to work on it too, and we'll design ourselves this way. There's another question here. Will you have another separate Kickstart funding round separate from this mentor program? Yes, we're going to be doing Kickstart again this fall. It'll be round 3 of Kickstart. And if you are familiar with the Kickstart eligibility criteria, it's going to be about. Okay, last chance for any more spoken questions. All right. We still have 3/4 of the people who started the webinar with us, so I'm going to take that as sort of evidence that folks have not been turned off too much by the answers to these questions. We still have a couple of more days before the interest survey is going to be closed. So we're happy to take questions. We're going to try to post answer to these online as quickly as possible. That'll be up tomorrow, I guess. So not much time left, but if you have a question, you can send it to us. Otherwise, I want to please encourage you, as soon as the webinar closes, there's a short survey. We're trying to understand just how much demand there might be for this opportunity. So it would help us out if you could take, we have 8 minutes left until 4 o'clock, so it won't take you that long to fill out the survey. So if you could please do that, that would be great. I want to thank Claire Tanner from Michigan Public Health Institute, Aroma Igwe here who's been running the webinar, and Q Kang, who's also on our team and has been participating. Folks, we appreciate your interest in DASH. We hope that this idea has some resonance for you, and we'll look forward to your submissions on the interest survey. Thanks very much.
Thank you.